Thanks for joining us this morning, everyone. I'm
Yeah.
pleased to introduce Rebecca Patterson from Access to Independence. Uh, Rebecca, let me turn it over to you right away so we don't waste any more time. Go ahead,
Okay,
please.
sure. So I am from Access to Independence. I don't know how many of you have heard of us or not. We are an independent living center, and we are one of 8 throughout Wisconsin. We serve Dane, Dodge, Columbia, and Greene counties, but there are independent living centers throughout the state, so every county is served.
Mhm.
Independent living centers are also all over the country. So no matter where you are in the country, whatever county, there is an independent living center that serves you or your friends or family. We are a nonprofit, and we are also over 51% of the people who work for Access or are on the board have a disability. So the independent living center itself is controlled by people with disabilities, and so there's a lot of say in what should happen and what we do. So we are, because we are covered over the country, we do get federal funding, and we are required to provide certain services, and that is the case with every independent living center throughout the country. So the services that we provide are information and resources. So that means people call us, people walk into the center with any kind of questions about disabilities or what they should do. And we are happy to provide any kind of answers we can to help answer those questions and overcome the barriers. We also provide skills training. And the people that we serve are people with disabilities, their families, their friends, professionals who work with disabilities, of any age and of any disability. And that's self-claimed. So if you believe that you have a disability, then we will serve you. So the skills training that we provide is from kids all the way up through adults. When you have a disability, there may be certain skills, certain things that you have trouble doing. And so we can work with you to figure out, okay, you're having trouble doing this. What can we do? What can we teach you so that you'll be able to overcome and learn those skills? We also provide peer support, because it can be challenging to be someone with a disability, and it can really help if you have someone to talk to or ask, hey, did you have this same issue, and what did you do? We also provide transition and prevention services, so that helps keep people out of institutions, or also then helps people get out of institutions, because it's really important for us that people live within their communities and live the lives that they want and they choose. That's very important to us. Then we also provide assistive technology, which is what I'm here to talk about mostly this morning. And as far as the assistive technology goes, we have hundreds of items that we can loan out, and they're here in the office, or we can borrow them for other IL centers. And some of that technology is complicated and high tech, and some of it is very low tech. And again, I'll show you some of that here in a few minutes.
It's your office, Rebecca. Can you give us the address?
Yeah, sorry, it's 3810 Milwaukee Street, and it's here in Madison, but we do travel. So if you live in Dane, if you live in outside of Madison, we are happy to come and help you. What we try to do is figure out, okay, what are your goals? Is your goal to learn skills? Is your goal to figure out what kind of assistive technology you need? And that also can be, you know, you may think, oh, well, I need this or I need that, and I need to do this. And sometimes it's a matter of being creative and then saying, oh, well, there may be something out there that's easier and less complicated. And I'm going to share a few stories about experiences that we've had with that. There is a WIS loan program. So if the technology that you need, or if you need a housing modification, there is a loan program. So you can apply for a loan that will help you pay for that technology. It is a loan, it's not a grant, but it's a committee. So they do look at people with disabilities and give them a little bit of leeway. They don't just say, oh, well, this person can't afford this, so, oh, well. So I just did a loan for somebody. They needed their driveway paved because they just got a new wheelchair and they could no longer get out to the sidewalk. So it was a way to, once their driveway was paved, they're now able to get out to the sidewalk and take walks with family members and get downtown to the stores. I've also helped people buy accessible vans. I've also helped people buy complicated alert systems through their houses. It really varies. And that's one thing you have to think about is, okay, I need this assistive technology, but I can't afford it. So what do I do? So we can help with that. And so I'm going to show you some items, and please, if you have questions, now that I've shared my screen, I can't see any raised hands. So Mike, if you see any raised hands, if you can bring that up, that would be great.
Yeah, I can do that. And feel free, if you want to talk with Rebecca, feel free to unmute yourselves and ask away, because it works out a lot nicer if we can get a conversation going
Yes,
here.
for sure. So don't hesitate. I'm fine. I like, this is actually the first presentation I've done with specific to assistive technology on camera. Usually I am someplace specific, so I can lay out various things and have people kind of play with them and ask questions. So I've done presentations before, but never this one. So let me start. There are some things, again, like I said, that are very simple. A lot of people, for various reasons, have trouble doing things in the kitchen. Maybe they've been cooking for years and then all of a sudden maybe they start to get arthritis, or they can't see as well. Or maybe like you all are here related to dementia, so it's harder for people to follow recipes. So we do have, there are books out there specific to people with dementia so that it helps them be able to follow recipes easier. The cookbook I'm thinking of right now comes with special measuring cups and special measuring spoons, and it's a step-by-step, and they're all the pages you can use a dry erase pen to check off the steps that you've done. And in the book it'll say, use the blue cup for flour. So the person isn't digging through going, what do I do? What do I do? It's like, okay, here's the blue cup. Here's the flour. Okay, that's done. One of the things I have here is a measuring cups, and hopefully you all can see this, is a measuring cup system, and it's got really large print. So people who are having trouble seeing things or they get confused, sometimes that larger print can be very helpful. We have things, there are lots of other kinds of things like electric can openers, things to help you cut, like there's a specific thing for cutting tomatoes. Really anything that you're having trouble with in the kitchen, if you contact us and say, I don't know what to do, I can't do this anymore, I've never been able to do that. And we can get pretty creative. We have a fully accessible kitchen here with lots of devices, so we're always happy to schedule a time for people to come in. Another thing I've got here is a reacher. There are all kinds of different reachers, and people use them. See, it's a grabber. So people use them if they can't bend over and they drop things. And so they need to be able to use this and lean down on the floor and grab it and pick it up. This works well for not just people in wheelchairs, but like my mom just recently had her knee replaced, and I lent her a reacher so that she didn't have to lean over and grab things. And I think it made it a lot easier for her. Instead of calling someone and having to pick things up, she was able to do things on her own. And again, there are lots of different kinds of reachers with different kinds of handles and different kinds of tips. We also have a self-leveling fork. And when I pulled it out a few minutes ago, the battery isn't charged. But basically, if your hands are shaking, or if your hands go like this, the fork itself levels itself out. So you're never going to be dropping the food off the fork. And it's very easy, as you can see, I'm not holding on to it. And so you can just get the fork into your mouth. That does very well with people who have, who shake or just can't grab onto things with arthritis. This one along a similar line is a device, and it's very simple. It's just Velcro. It goes around a water bottle or a mug or a cup, and it's just hanging off my hand, and I can just take drinks, and it helps it stay steady. It makes it so it doesn't spill so easily. And it's, as you can see, I've got water. It's a full water bottle. I've got water in here, and it works really well. This I have here is a small camera, and it magnifies things. And it works really well if you are trying to read something on a page, or maybe a menu in a restaurant, and you set it down on the paper or on the table, and it magnifies things. So then you can read the menu or the document, whatever you're trying to see. It's incredibly helpful. You can also change the colors. So it might be, you might have it be black on white, or you might change the print so it's black in the background with white print. This one I also like, and I found this, somebody was in a grocery store one day, and it helps carry plastic bags at the grocery store. Because I don't know, my hands work pretty well most days, and I don't have trouble carrying plastic bags, but it is sure hard. So this turns, and you hook the plastic bags into it, flip it back, and then you're not killing your fingers with all those little plastic bags. So again, that wasn't even meant for someone with a disability. I just saw somebody with it in the store one day and thought, hey, you don't have to carry those awful plastic bags anymore.
I was thinking about that, Rebecca. I've got a good friend, and his fingers look like the twisted branches of an old tree in winter. I mean, they're twisted every which direction.
Yep.
He has a lot of trouble carrying anything.
Yep.
And so something like that would help out, especially if there were, I don't know, maybe even, I just don't know how it would work, because his fingers don't work a whole lot anymore.
Right.
But these things for people who have, what's the illness called where your fingers get all twisted out of shape? Some sort of arthritis, right?
Yeah, I was going to say, I don't know what, usually that's some kind of arthritis. I don't know. I'm in no way a doctor. Usually what happens is people contact me and say, I can't do this, and what am I supposed to do? And it's like, well, it doesn't particularly matter to me why you can't do it. Let's solve the problem.
Yeah.
And so we've had some pretty unique situations.
Interesting.
This is, I know a lot of people take lots of different medications. It can get confusing. This is a pill reminder, and it's actually a very complicated one. You can get really easy ones just at Walgreens that just help you organize your pills, and you just flip them up when it's time and take the pill out. And then later on, when you're going, oh my gosh, I forgot, did I take my meds this morning? Then you can look at this thing and say, oh yeah, I took them. All right, Monday morning, yeah, I took them. Or even just help you organize them at the beginning of the week, saying, all right, Wednesdays, I know I have to take this in the morning. So you set it up and then through the week, you know what you're supposed to take. This one is more complicated. It has an alarm on it. You can do it. And so if you have someone who maybe has a habit of taking their meds at the wrong time, or so it's not just a matter of forgetting their meds, it's just, you know, oh, well, gee, I should take these pills now. So it won't, the little compartments won't open until the alarm goes off. And they do, I believe this one you can even get at Walgreens. But they do even get more complicated than that. This is kind of mid-range for complex. They have some that, you know, you can't even pick up. They're hooked to the wall, so somebody can't walk off with them. So that, you know, if you get somebody who tends to, for whatever reason, they play with their meds, they take their meds, they forget to take their meds. And something like this makes it so that you don't have to worry about that, whether it's for yourself or somebody that you care about. This is what's called a sock aid. And this is a really big one. They do have smaller ones, but you put your sock around it and it makes it very easy then to pull your sock on. So again, if you don't have much leverage, you can't lean over, it can make all the difference. And again, it's also, you know, some people can't even grab their socks, so they can't even pull them on. And this then allows you to be able to do that. Let's see, what else do I have here? We also do a lot of work with people who either can't hear or are losing their hearing. So there are all kinds of situations with that. The first one I want to say is, you know, people who like to watch TV. Maybe they live alone and they want to be able to watch TV on their own, but they're blaring it. And so, you know, the people across the street can hear it. This little device hooks up to the TV and it can connect to a hearing aid, or it connects to headphones. And so it makes it, you can make it as loud as you want so that you can hear it and the rest of the world doesn't need to. Maybe you watch TV with a friend or a partner and they don't need the help listening to it and you do. And this way you don't have to blare out the sound. It can be really helpful. I've got causing problems here. There are different kinds of headphones that people can use. You know, we're all used to kind of these days, the ones either that sit over your ears or the earbuds that sit right directly in your ears. These are what's called bone conduction. And they actually designed these initially for people out running or out walking, doing things that they want to be able to hear the sound, but they also they want to be able to hear the sound around them. So if you're out running or walking, you want to be able to hear, oh, gee, is there a car coming? Is there someone running up behind me? So they actually go over the top of your ears and they sit right on the side of your head. And the way that they work is you can hear through the bones in your head. They work similar to something like a cochlear implant. I don't know if any of you know about that. But for someone with hearing loss, a lot of times the hearing loss is not, it's neuro, it's not specifically in their ears. So these things you can even get them online. You can get them at Best Buy. They're only about $20, I think. And we had a situation one time with a woman who came in and she had a lot of difficulty hearing, and we put these headphones on her and she was able to hear her grandson talk for the first time. And all of us were in tears. It was just, you know, one simple little pair of headphones. And so that's what I have here sitting on my desk. We have different kinds of alert systems. So if you can't hear around the house, you can't hear your doorbell, you can't hear somebody in the other room, we've got different kinds of systems that we can set up really easily to fix that problem. I'm working with a couple right now, and he once he takes his hearing aids out, he cannot hear. And his wife actually is in the early stages of dementia and is also starting to fall. So when she gets up in the night to go to the bathroom and she falls and she calls to him, he can't hear her. She could yell for hours and it wouldn't make any difference. And excuse me, it wouldn't make any difference. So we hooked up one of those alert systems so that it will detect a loud voice, and there's a special shaker that fits under his pillow. And then it also causes lights to blink. So if she yells and calls his name, if she falls, the bed will shake and the lights will flash, and that will wake him up to be able to come and help her. So that's just something it brings to mind because I've been helping them set that up. And we originally shot, oh, she needs a system where you have the pendant around your neck and you press the button. And it's like, well, he's not going to hear if his ringer goes off. It doesn't matter. She can press the button forever and it doesn't matter. But with that system, then all she has to do is yell his name and it will wake him up. So does anyone have any questions? Any things that they're struggling with right now that they want to bring up?
Rebecca, I have a question.
Mhm.
Do those devices, do people borrow those, or how do they purchase them from you folks, or
So
how?
we don't sell anything. We have the loan closet so people can borrow different devices and try them.
Okay,
There are depending on the technology, there are different places and different ways to purchase the items. And sometimes we can connect people up with the funding to do that. Sometimes it's just a matter of helping them find the place to buy it. And if it's something that's very expensive, then we've got the WIS loan program. There's also a program that helps people purchase items for long distance communication. So it helps people buy phones. It helps people buy accessories for their phones. It can help people buy those alert systems because those amplify the phone when it rings. So that's a grant. You don't have to pay that off. It can also help if you are using a tablet to communicate. It can pay for those tablets. So that can be really helpful for people.
thank you.
I was thinking, Rebecca, about the cost on this because you mentioned the one fellow whose wife was falling down and he was deaf and he couldn't hear her hollering for. So there was a lot of modification there. His bed was shaking and his lights were flashing to try and get his attention. I mean, that would seem to be a fairly costly thing for a single family to arrange.
It's about
Is it?
$150.
Oh, only
Depending on-
150?
Yeah, they're actually not very expensive. And they're very easy to set up. And no, they're not that expensive. You can even get simple ones on Amazon.
Mm-hmm.
So
I see, that's like an alarm clock.
it is, and that's the way it goes. They are originally they were designed for people who are deaf, who can't hear their alarms go off. So it operates through an alarm clock. It just that clock picks up the signals from the other devices around the house. But no, they are not that expensive. They're different brands, some of them better than others, some of them easier to hook up than others. So
I can see where it would be of a great advantage to be able to talk to you, and well, I guess I muted myself. It's just saying there would be a great advantage to be able to talk with you because how many of us buy a bed shaker system to get us to wake up, when the wife falls down? I mean, your advice is, the most important part of the whole process, I think.
Yeah, and it's a matter of, you sometimes you just have to get creative, and sometimes it's not even assistive technology like the bag carrier, you wouldn't think of that as assistive technology, but yet it can help a lot of people out. Or the bone conduction headphones, that wasn't necessarily designed to be assistive technology, but yet somebody saw it and went, oh. And I was just working actually with a mother and her daughter is losing her hearing rapidly. And we just managed to get her one of those headsets, and it connects up with a TV. It actually connects up with the microphone that her teacher has. And so she's now able to hear the TV, hear her teacher in the classroom, connects up with her phone. So she can use that instead of having to buy really expensive hearing aids.
Anyone else? Feel free to chime in.
Anybody?
I have a question.
Sure.
I have arthritis in my thumb joints, and one of the things I like to do a lot is to knit, and it gets harder and harder to knit. And I'm wondering if you know anything that you could attach to the knitting needle, or anything that would help grip a knitting needle.
Yep, there are devices that were originally designed to help you hold pens. And those can be attached to knitting needles so that you don't have to use your thumbs, or you don't have to use a lot of pressure on your thumbs. And there are all kinds of those. We have a lot of different ones in the office that would fit over a knitting needle. And some of them are just, they have a heavier weight to them. So like if someone's hands are shaking, and they're also bigger around, and then the pen or the needle would slide into it. And so,
Okay,
yes, there are
Good.
definitely things out there to help with
thank
that.
you.
Yeah,
That sounds good.
yeah.
Yeah, I have a question.
Mhm.
I have trouble inflating the tires on my car because I have arthritis in my hands, and that's a very small thing to work with, and the caps on the post is sort of hard. So do you have anything for that?
I would think that there would be something to be able to clamp onto that, so then you wouldn't have to put so much weight on your hand, or use so much, you wouldn't have to use your hand so delicately. So yeah, I don't know of anything, off the top of my head, but I know that there would be something out there that would be able to clamp on to those.
Thank you.
Mhm.
That's a disadvantage of having self-service fuel stations these days.
Yes.
You just don't have the attendant there. It used to be, when I can still remember, this was a while back, and y'all probably can too. You used to pull in and get some gas, and they'd run out there, fill your tank, check your tires, and send you on your way. It was
That was
just
so nice. You never had to grab yourself out of your car when it's 50 below.
exactly,
Make someone
exactly.
else do it.
Much different. I'm wondering, Rebecca, to what degree are some of these higher tech devices being integrated into our communications technologies, cell phones, smartphones, that type of thing? Are you seeing any of that? The other day, I saw a guy who said that he had, as a way of detecting COVID, he takes his temperature every day.
Mhm.
And I mean, those thermometers send the information to a central database that collects information from all over the country, and regions can be disaggregated so that he can check and see what the temperature level is on average here in Madison. And so, are there other things that you're using that try to connect into the web?
Well, that I'm assuming that's like through an app that he put on his phone, or somebody put on put on for his phone for him.
Yep.
So as specific to a thermometer, you know, I'm assuming, you know, they have thermometers that are bigger that talk.
Mhm.
But the thermometer itself, I'm assuming is connected directly to that app. Is that what you mean?
Yeah, I think it probably connects through Bluetooth and
Mhm.
into the app, and then the app sends his information to wherever, and this information's aggregated. I got to thinking, you know, increasingly people are finding ways to do this kind of thing, provide more information than we ever wanted to get. And so I didn't know if that was becoming a thing with assistive technologies also.
With some of them, I mean, I have at this point, it's more, you know, of an individual basis. There are apps that people can download onto their phones that, you know, make it easier to use the phone. And, you know, like, and I also, the other day I was working with someone and he was having a hard time understanding me. And I had an app on my phone, and so I just turned that on, and then it started typing out everything that I was saying. And you can get some that are very complex, but with that, I literally in 30 seconds we were able to communicate, and I wasn't screaming at him, and it just made things much easier. And then I was able to put that on his phone. I was watching a training the other day, talking about artificial intelligence and gathering different kinds of data so that they can create, you know, better kinds of assistive technology. So, you know, that kind of just comes through the phones, and as far as gathering information specific to what people need, I don't know.
Question, do you go to people's homes and do like safety evaluations?
Yes.
You do, okay.
Yeah, we can either work for, if somebody is on a long-term care program of some sort, like, you know, with MySil, they're getting, you know, their long-term care paid for. They can pay us to come to the home and do a safety assessment. We also do them for free for people who don't have, you know, who don't have that kind of coverage. So yes, we can come to people's homes and talk about, you know, what might be dangerous in this home, or what could you do to modify it? Where would be the best part to put grab bars? We can provide a list of contractors for the person then to contact to, you know, to work with them about what kind of modifications that they need. We do loan out ramps. Sometimes people, I loaned out a ramp the other day to someone, and she had a spinal injury from a car accident and is now using a wheelchair. And her house itself was pretty accessible. They didn't have to do much, but yet she couldn't get up the steps. So we were able to loan her a ramp temporarily, so at least she could get home from the hospital, and then they would have their own ramp built. But it was, you know, otherwise she would have just been sitting in the hospital or sitting in a nursing home while they built the ramp. But this way she was able to just get home.
Kristen, let me ask you for a second here. In your work, do you think that people in the community are aware of the services that Access to Independence offers? Do you think that the word is out there, or is Rebecca kind of a stranger to most people?
Yeah, I don't know that everybody is aware of all the services that you provide. I mean, I definitely heard of Access to Independence before. I'm familiar with your organization. But it's good to know all these different devices that you offer, and like I guess I wasn't sure that you guys did home safety eval. So that's really good information for me to know, and I'll share that with my team, you know, that you guys do those. That's wonderful.
Yeah, that's something we've started up doing within the last maybe year and a half or so. And we're getting more and more evaluations, and they can be really formal evaluations, so they have a full written report. So in that case, somebody who's getting a modification paid for, then they've got this solid report to go off. Instead of just somebody saying, oh, well, I want grab bars in the bathroom, we can provide that support, that report to say, yes, you need grab bars in the bathroom, they should be in this particular spot. So, or this kind of ramp, these steps are unsafe, or, whatever that might be. Sometimes that formal report can help
Rebecca, do
get
you-
those services paid for.
yeah, Rebecca, do you think like that maybe like the ADRC would be maybe a little more familiar with like your services, and maybe like me and APS, like the resource center, the Aging and Disability Resource Center in Dane County, maybe they're a little more familiar with all your services than say.
Yeah, we do get a lot of calls and referrals from them.
Okay,
I
okay.
think it's hard. We do help people with disabilities as far as housing goes. We can help them fill out housing applications if they can't see, or they can't write, or they don't know how to use the computer. But we don't have housing. We don't find housing for people. And I think for some reason, people have gotten that idea that we have housing, and that we can actually, we have connections in the community, so we can find housing easily and quickly, and we don't do that. So we've unfortunately been getting a lot of people contacting us to do that kind of thing. But we do work with the ADRC.
Rebecca, and sometimes if someone needs a fairly major modification for a home, you can, do you have access to grants for that, or?
So we do have a list of contractors that we can give you. The WIS loan is a program that can help pay for those kind of modifications.
Okay.
There isn't anything that I know of that would do it for free. But there are ways to help provide some financial assistance.
Andrew, go ahead and chime in here. Rebecca, Andrew Mueller has got a question.
Yeah, do you have any ideas or assists for people who are tobacco smokers but may have like movement disorders or other physical disabilities?
So like they want to be able to hold the cigarette, you mean?
Correct. Yeah, that they might drop it or.
Right. You could probably use some kind of pen holder for that. Or something that fits around the fingers, or is heavier, that you could put a cigarette through. That would be a matter of looking at the different pen holders, and I've never had anyone come in and ask to use that to hold a cigarette, but I don't see why it wouldn't work.
Thank you.
How do we
Anything else?
contact you?
So I can give you, I'm sure that Mike, you can send out my contact information. I can tell you right now, again, that was one of my slides that had that information. The best thing to do would be to contact our main desk, which the number is 608-242-8484.
Can you put that in the chat box? Do you have a way to do that, Rebecca?
Like I said, for some reason, sharing my screen wiped out
okay.
all my.
Oh, all right.
And now,
608. Say it
now I'm
again.
not even able to move my mouse.
All right, say it again. 608
242
242
8484.
8484. Okay, so I just put her phone in the chat box, everyone, in case you missed it.
And we do provide a lot of information referral. We get a lot of people who just call saying, I have a disability, or my friend has a disability, or I'm working with someone, a client who has a disability, you know, what ideas do you have? Who can I call? Who can I talk to that might be able to help?
So how
we do a
many
lot of that.
people, how many people at the Access Independence are like you, working with individuals to find solutions to their,
We have, let's see, 1, 2, 3, 4, 5. Right now, I think we have 6 of us
Mhm.
in the office. But you know, we're not going to deny anybody services. So
is there a backlog to
no,
get an appointment?
Mm-mm.
No? Okay,
No.
that's good.
Yeah, I mean, sometimes you might have to wait a couple weeks because we've got something else going on, but for small things, we can usually handle it quickly.
Mhm.
And we do make sure that if somebody calls and you have to leave a voicemail for some reason, we do make sure to contact that person within 24 hours,
Okay, that's great.
but there's not a waiting list.
Feel free to chime in and while we still have chance to talk with Rebecca here. Anything else?
I seem to have questions about how to pay for this. Does insurance cover some of your,
All our services are free.
okay,
You know, if you had to buy assistive technology, then we would help you, you know, figure out how to buy it. But, you know, if you contact us for information or just to try to figure out what kind of assistive technology might help, you know, or like the home modification reports, all our services are free.
okay.
So do you have someone on staff who's familiar with all of the Medicare rules and the various program rules, Medicaid, all of these things? I don't know anything about it, but is there someone there who can guide people through the financing process if it's an expensive modification?
Usually, I mean, we can, a lot of times, you know, we can refer people to the ADRC.
Uh-huh.
Most of us can at least start to give you ideas about what may be able to help. We don't have anyone on staff who is, you know, a financial specialist or anything like that. But, you know, yes, we do, you know, lots of times we can to help you, you know, talk and figure out whether Medicare will cover something.
I think that the ADRC is an organization that a lot of people don't know how don't know much about it. I mean, it has a lot of capabilities, and that's always a great place to give a call. Anyone else? Thought we'd go for an hour, but we're seeming to wrap it up a little bit early. No one
Yeah,
else?
anyone?
Okay, well, I'll just thank you then, Rebecca, for giving us an hour, well, not quite an hour. Gonna let you off a little early here.
Yeah, no
Thank
problem.
you
And
so much for the terrific information.
please feel free to contact us. And like I said, our services are free. Whatever question you have, it will get answered. Sometimes if you have something that is a continuing issue, we can help with that. We like to help people set goals and figure out how to accomplish things. And again, it's not just, it doesn't have to do with just assistive technology. It can be other things too. So, and if we can't do it, we can always help match and figure out who can.
Terrific. Thank you so much. And thank you everyone for attending. Really appreciate you joining us today.